Hello, everyone, and welcome back to the Digital Health Wire show. My name is Jason Barry. I'm the editor of Digital Health Wire and the host of the show. Today, I'm super excited to be joined by Rik Renard, who's a longtime Digital Health Wire reader. I'm a longtime reader of Rick on LinkedIn, actually. And he is now also the head of strategy and product, I believe, at Sword Intelligence, which is the AI kind of arm of Sword Healthcare, the virtual started as a virtual physical therapy company. We'll get into it moving far beyond that. Rick, it's great to have you here.
Thank you. And I'm definitely a big fan of the newsletter. Many of my LinkedIn posts are actually, I see something in your newsletter, I read it, and then I tweak it with my own thoughts and I click on
Uh,
publish. So thank you for also helping me find interesting things to write about. So
well,
kudos.
I love to hear it because a lot of the stuff in Digital Health Wire, I catch wind of it, seeing it on my LinkedIn feed with you. So
Full
glad I could
cycle.
return the favor. So, Rick, maybe you could start off by giving a quick intro to your background. I know you had a past life or a current life as an RN, and then you moved into kind of the product sphere. Now you're at Sword. So, if you can kind of just give us the quick version of how you ended up at Sword, and then set the stage with what you're working on the Sword Intelligence team.
Yeah, so my background, so I'm from Belgium, so obviously I don't live in the US, and I always say like I have the pleasure of trying to fix US healthcare, but I don't need to experience it day by day, which I think is definitely a blessing. But like when I started my career, I did my nursing degree, and then after 3 months, 3 years of studying and doing all of these internships, I was like, I'm not really a good individual to take orders and just like obey and say, yes, I will do it like this. And as a nurse, unfortunately, you meet a lot of physicians that sort of like say, this is what you need to do and you need to do it in that way. So like I was like, this is not for me. So I did my master degrees and then I joined a very tiny B2B SaaS company called Daywell. Where I was a working student and I loved the startup environment and I was like, damn, this is pretty cool. And I was there for almost 5 years, and I did a ton of cool things. And then after 5 years, I was approached by someone at Sort, and actually by the CEO directly as well. So I had a few interviews with the CEO, and I think once you have the opportunity to meet V Bento or like V or CEO, and you talk to him, like you want to work for this guy, not only because of his attitude and in the way that he thinks, but also just because of the vision. Like as you pointed out, Sort Health is an AI care company, and I think we are currently the biggest AI care company in the world, and we will continue to be the biggest and the largest. And that really attracted me to the company. And then to your question about Sword Intelligence specifically, like Sword Health is AI care company, and like we're best known to deliver virtual physical therapy at scale with our Thrive product. And then we expanded into pelvic health. We're expanding into mental health and a few other disease areas. And like the way that we provide care to employers or with health plans is always like you have the AI care component, so like an AI care agent that helps you get through your treatment journey. It's often also coupled with like a device, a physical device, can be a tablet, can be a wearable, and then also a human, so a physician in the loop, a clinician in the loop that helps you navigate through like your rehabilitation process, for example. Now, in order to scale our own care operations, the team has obviously built an insane amount of internal AI tooling to make them more efficient, to make our care teams more efficient, to make our care coordinators more efficient. And that's essentially the idea behind Story Intelligence is taking the internal build products that we have and that have been validated and tested at scale and selling this as AI solutions or offering them as AI solutions to health plans, governments, big health systems across Europe and the US. And that's what we're building right now with my team.
I've been a fan of your CEO V from afar. It seems like Sword has an interesting kind of entrepreneurial team structure that I've seen him post about and talk about on LinkedIn. I won't butcher the exact definition of how that works, but could you kind of lay up for us what does the team structure, how is it unique at Sword, and how does it kind of empower your teams to focus on delivering awesome solutions to your customers?
Yeah, and V actually has a good article on his newsletter or his blog, Planting the
Uh-huh.
Seeds of Innovation, I think is it called.
Okay.
But like the my definition of it, and hopefully it doesn't kill me that I define it or explain it wrongly, but essentially my definition of it is like we hire people. So in our case, for intelligence has a general manager at Berkeley. He's like someone that built, he's a founder himself, built, sold various companies, extremely successful. And then he came in as a general manager for Story Intelligence. And that becomes their own division, which its own P&L and its own people. And we
Mm,
can operate in a very, like in a startup-like environment but while having the benefits of working with or at a massive organization. So, for example, we obviously get support from HR and talent to hire people. We get support from legal to do things. But like we as a division, we have our own P&L and we have our own responsibilities, and we don't like we can operate as quickly because we are ourselves, and we don't need to, for example, align with six different divisions on a sales strategy. We can just do our thing in our specific way of working and get it done and build our mini culture within, of course, the awesome sort culture. And so how that then works is you get a budget. So the GM gets a budget for 12 months, and then you have 12 months to prove that you have product market fit. And then after 12 months, you need to pitch sort of like a Series A
mm.
pitch to the executive team of like, hey, this is what we got in 12 months. Would you like to extend what we are doing? And so you have actually 12 months to prove what you're doing works, and then you get more budget internally, of course, to do more beautiful things. So I think sort is like put simply, Sort Health is sort of like the VC arm, and then they bet on founders, but founders are in our case GMs to
Mhm.
prove product market fit within a segment that they're extremely passionate about, and then have 12 months to prove it. And then every cycle after that, they have more proof points, and then obviously they can get more budget to grow within their vision.
At first glance, I'm a huge fan of that structure. It seems like a good way to align incentives, keep everyone hungry.
Yeah.
What are the trade-offs that you get with that? It seems like a good way to avoid kind of the bloat of too much bureaucracy. Like as you scale up and have a huge organization, but does it create competitive dynamics between teams? I imagine being on the AI, VCs have favorite portfolio companies, if you will. Does it create a little bit of tension there, or maybe,
So
yeah? What are kind of the trade-offs that structure?
I think one of the biggest benefits, sort of like whenever I was working at my previous company, we were like 25 people, so like tiny, and I could do whatever I want. And so
Mhm.
obviously working at Sort, which has like 4 billion valuation, so has a massive scale. I was really afraid of like getting my soul sucked out of it because of the bureaucracy. It's like working at a big organization means that you need to comply with all of these processes. And of course, we do have processes because we have a responsibility to our patients and members. But like the big benefit is sort of like we are still having that startup environment, and we can move extremely quickly within that division, and we can do our own thing, obviously with leadership from the general manager. The downside, which I think is actually the only downside that I see, sort of like it does create some silos within the organization. So it could be that, for example, Story Intelligence reaches out to one payer and that actually they're also talking to that second payer. But you can
Mm.
easily mitigate that by just having clear communication lines between the divisions as well. And the silos in itself, I think, allow us to move much quicker because I don't need to know what that other division is working on like a daily basis, but they do send like weekly updates to the GM and the second in command of like this is what we're doing. So like they already mitigated all of these concerns of like failing, like the silos in itself are already tackled by the clear organizational structure that they have in place. So once you have the good processes in place and the right communication channels, I only see this as a benefit. The
Mhm.
biggest downside is more like, can your culture handle it? And I think Sword is a unique company with a unique culture, so they can. But like, if you try this within a massive organization that has like been moving at turtle pace for ages, like that will never work. Your culture needs to be aligned with this as well.
Well, perfect. I was a fan of it. Now might even be more of a fan of it. Zooming in on your team and landing that Series A or whatever stage of your funding arc you're on right now. Yeah, you've had an exciting week this week. I saw some big news come across the feed. Can you kind of tell us about what the Sword Intelligence team is up to and is going to be working on this year and going ahead into 2026?
Yeah, so one of the things that I feel most proud about is the work that we announced yesterday on our partnership with the Greek government. So
Mm,
essentially, what was announced is that Sword Intelligence and Sword Health as a whole will be working with the Greek government to transform their healthcare or their public healthcare system and make it AI native. And as part of that, we will actually be doing the first national deployment of voice, I think in the world, but maybe someone can correct me, especially I think in Europe. I don't think any other government has done voice AI deployment at scale. And so a big part of that is what they call the 1566 line. And the 1566 line is sort of like the one-stop shop for every Greek citizen to get access to information about the public health system, but also to help with like scheduling appointments, canceling appointments, finding a good doctor, and all of that. And so right now that line is staffed by humans mostly, and it's obviously also not everything of these capabilities they have. So it's also a lot of Googling. And so we want to use voice AI to automate some of the parts that don't need any human. And there will always be a human in line. Like whenever we need an escalation, there is a human that will pick up the phone. And it's sort of like, hey, Jason, you're a Greek citizen. You call in and you want to schedule an appointment with Dr. Whoever. The voice AI picks up the phone, it listens to your request, and then helps you schedule that appointment. And then after that, you also get sort of like a confirmation text there as well. The second piece of it is sort of like the I Prevent campaign. So like in Europe, in most European countries, I don't think it's true in the US, but like you can get access to free screening for many diseases. Like in Belgium, for example, if you're between 50 and 74, you can get free colon cancer screening. You can get free breast cancer screening between a specific age as well. Also, cardiology screening as well. And so the uptick of that screening is not always great because, like, you try to engage patients within SMS, email, sometimes mail, physical mail. But like obviously not everyone is has a phone, not everyone picks up or looks at these text messages. And actually
mm,
what we see in our data is like a lot of engagement can happen through voice and phone, but you don't have humans that can call 11 million citizens or 10 million citizens or 50 million citizens ever. So like that's why voice AI comes in. Like we would be using voice AI to call those citizens to say like, hey, Jason, you know that you're eligible for this free colon cancer screening. It's free. It's very
mm.
easy. We will send you a kit. You send it back, and then after that, you will know, and we will keep you healthy on that. So that's the second cool part. And I think the third coolest part is the triaging itself.
Mm.
And sorry for rambling. I'm obviously very
No,
passionate
please.
um, but so the problem that they have, and I think every health system has it, sort of like too many people go to the ER. I think in Greece case, it's 30% of the people go to the ER that
Mm,
shouldn't be there. So like they should go probably to the primary care physician or to another specialist, but they shouldn't be in the ER. And so their ERs are extremely crowded. And so we are going to deploy a medical device. Obviously, it's Europe, so it will be a medical certified medical device that
mm,
will do the triaging. So imagine Jason wants to go to the ER or wants to see a primary care physician, and obviously all of this is they don't need to like they have the free of choice to just go to the ER whenever they want. But
mm,
in case they do the triage, they fill in the symptoms,
mm,
you answer some questions, and then we get sort of like an output, like okay, Jason. You actually just need to go to a primary care physician because you probably have this. Let's help you find the primary care physician, and then we will help you with scheduling. Or, okay, Jason, you actually need to go to the ER. We see that the waiting queue in this hospital is actually quite high. We see that the waiting queue in that hospital is lower. So let's send you to that hospital and go there instead of going to that other hospital. So sort of like deburdening the ERs, but also navigating the citizen to the right level of care at the right time. So it's like right time, right care for the right
mm.
citizen, I would say.
That's an exciting project, and it seems like a big lift as the head of kind of strategy and product vision for that. How do you kind of start taking bites out of that big mission? Do you have like a timeline for when you're expecting to roll out pieces of this or all of it at once?
Yeah, so the I think the first pieces will be rolled out around Eastern 2026.
Hmm.
And the way that we deploy any of this is sort of like, obviously we take a clinician first approach in everything that we do. So in this case, like you have all of these physician groups, you have the ER stakeholders, you have the primary care stakeholders. So like it's spending almost like like an unreasonable amount of time with the people on the floor to deeply understand what are the problems exactly that you want to solve and how do you want this solution to be working within your existing workflows. And so we have me, which obviously I'm a nurse by training. We also have physicians on staff. So within Story Intelligence, we have a full-time physician that
Hmm.
helps us guide those conversations. And then once you have mapped out sort of like what needs to happen, and what do we identify as sort of like these are the problems, then obviously we go into building and validation mode. And whenever we go into that cycle, we obviously try to ship things quickly, but also, of course, like in a safe way and in a compliant way and all of that. But what we don't want to do is sort of like do one big launch and then don't iterate for it for 12 months, like what we see with AI, because the space is moving so quickly. We identify the problems, we take the stakeholders in our journey, we launch something that is like proving value that gets something and some problem solved, and then we iterate from there based on the data, based on what we see. And throughout that entire journey, it's always continuous improvement, and it's always bringing the end user, which is both a citizen as a clinician, through that as well. Because I was talking like we take a clinician first approach. Of course, we also take a citizen first approach because they're the ones using it, and we need to also identify and understand what their bottlenecks are and what their concerns are, and to also ease those within the implementation as well.
Nice. That'll obviously be a pretty big lift and a major focus for next year. Is there anything else on the Sword Intelligence team that you're looking forward to or that you can kind of tease for us that is coming down the pike either next year or in the future that you're excited about?
So this is a very European focused type of engagement, but we
Hmm.
are doing also some big things within emergency and non-emergency lines within the United States. Cannot spill the beans just yet, but like expect some big partnerships and announcement there in Q1 2026 as well.
Okay, very cool. And then while I have you here, I think I would be remiss not to ask while I have you on the call, when you're kind of drafting up a LinkedIn post or picking a story to share with your rabid fan base on social media, what's your secret sauce? You're such a great follow. I think I just personally want to know what goes into it. Is it you keep it human, you keep it funny? How do you do it?
So the first thing is being chronically online and spending way too much time reading your newsletter and other newsletters and on Twitter. So like my brain has so many juices coming in from left and right, so that I always need to pick what I want to write about. And then indeed, I think my writing style resonates with people because you have so much AI slop that it's like pissing me off on LinkedIn and on Twitter and everywhere. Like you can tell immediately when it's written by AI. And writing with AI in itself is not a bad thing. Like I also write with Claude, but obviously I tweak it in a way that sounds human and that sounds like me. Well, what some two people do is sort of like, hey, summarize this article, and then they just copy paste it, and it's like, dude, what the ever are you doing? So I think it's indeed making it human, and my secret sauce, which I will spill the beans on, is I use something like Whisper. So
Mm.
I just talk to Claude, sort of like, hey, I saw this interesting article from Jason. These are my thoughts. Write something about it. And because Claude is so good at writing, and then it takes my way of talking because I'm actually talking to my computer, and then it just makes an article out of it. I think that's
Mm.
probably what makes it human. Is because whenever I write an article, I actually tell what the article should be. So every workflow that I have right now in my day-to-day and professional life, I think I don't type much anymore. Everything that I do is controlled by my voice, which is pretty cool.
That is a pro tip right there. I imagine that I try to write using my like natural language voice as much as I can, but actually using my voice instead of trying to like translate it to my fingers, I imagine would only help.
Please do. Please test it out. It's amazing. It changed my life. And obviously we are doing all of these voice AI deployments. So me using voice wherever I can is is a big plus as well.
All right, Rick. Well, everyone should make sure to give you a follow on LinkedIn and Twitter and wherever else you're sharing your thoughts online. Thank you for coming on the show, sharing a little bit about Sword and about the partnership that you're doing with Greece and next year. It's been a pleasure talking with you. I'll let you get back to your day, but thanks for coming on and sharing.
Thank you. Have a wonderful day.
All right, everyone. That's been the Digital Health Wire Show. Thanks for tuning in, and we will catch you next time.